Hello and welcome to Days Info Video Bites. We have Abhinav today from OurHeathMate with a very interesting concept of helping NRIs look after their parents. Let's go to Abhinav. Abhinav, what do you exactly offer with OurHeathMate?
Indians have been facing a big problem overseas. They send $10 billion back home just for health checkups and healthcare in India. But what they get is no feedback coming from the doctor whether the health checkup was provided. Being a cultured society, we can't question our parents what has been happening. So what we provide is making sure your parents go for health checkup, everything prepaid straight to the doctor, and what a NRI gets in return is a feedback coming straight from the doctor. So you can manage your family's health, manage the amount of money you want to spend on your family's healthcare, and be ready for anything which might happen.
That's very interesting. So, does this happen? The health checkup happen on only a preventive mode, or does it also happen when there are emergencies?
Currently, our focus is only on preventative health checkups, which include health checkups, health screening, and surgeries. In the future, we might move into, but that's still pending.
So what do you think is the market size as of today, and why NRI?
There are 22 million non-resident Indians staying overseas. 10 million of them are just expats. 80% of the $70 billion which come to India through NRIs come from 6 countries in the world. So we can see that the population is very concentrated, sending it money for an exact cause, and that's why NRIs. Next in the row is Philippines, which sent $28 billion. Same for Mexico, $6 billion for healthcare. We can replicate this model in the other countries, but why not start in my own country?
That's very interesting. Okay, you talked about the 6 countries that most of the money comes in from. Could you name those 6 countries?
I'll name few. So it's UAE, US, UK, Canada, Australia, and the 6th Malaysia in the order of money coming in.
Interesting. Malaysia also. Very, that really gives me another insight. When we're talking about, all these places, all the people in all these places paying you money, they would only look at the currency that they are familiar with. So do you have anything that will keep them, cozy, to make sure that, I understand what the expenditure is there in my currencies? Is that something that is offered as service?
Currently, we are just offering the service in US dollars. But over the period of time, people will be able to convert and see. But what we promise is, if your families goes by themselves, talk to a doctor, wait in the queue for an hour, go for the health checkup, they pay the same amount of money. When you go through our portal, appointments done, you see the prepaid money, the feedback being provided, and the records have been digitalized for the same cost.
That's interesting. Now, most of the Indian families, right? They look at their Mediclaim cards or their cards of health insurance, etc., which they use to pay their bills. Do you have a facility to accommodate that as well?
The system can accept insurance card, but we are not launching that feature. India is a country where the insurance penetration is only 0.7% for non-life insurance. And with 0.7% for non-life insurance area, we don't have to worry about that feature right now. Also, most of these health insurance, they don't cover any preventative health care. And that's what we are offering. They mostly cover surgeries, emergency cases, anything which happens. But in the future, we'll launch that feature will get opened up. It's already been built.
That's very interesting. So who are your partners, or who are the people that you basically would work with?
So on one side, we have been tying up with different hospitals all around the world. So we have more than 200 hospitals in India. You should go to our website to check them out. We have signed a few hospitals in Singapore and US. So soon will be able to either get a second opinion, or if you want to send your family to overseas for health checkup and health surgeries, you can do that through our portal. On the client side, we have been tying up with enterprises and Indian societies all around the world to come on board, because we provide their members a peace of mind during any festive season. Deepavali is coming.
Okay.
Instead of sending gifts as money or anything, you can just send health straight to your families.
Wow, that's very interesting. This is a very new outlook that I see. Now, when you look at these NRI families that are there, is there some way that they can plan, based on these preventive checkups, etc., that you do, and help budget for them that they can send every month? Is there something that on your platform helps them do that?
So we have subscription models. People can choose that how much amount of money they want to spend. We actually did more than 500 interviews before we actually decided the pricing and everything and the market we are trying to cover up. So people can do that. People can see each and every pricing. We have models starting from $10 and going up to $200 right now. So it covers a large amount of crowd and area.
So when you said $10 to $200, is that apart from subscription, is there any other revenue model that you have, or is this only subscription that varies between 10 and?
So one of the revenue model is that we get money from commission for every health package sold. The second thing is we charge money for every record which has been digitalized, because we have been helping doctors and hospitals to upgrade their infrastructure. So that product is also generating money not only in India but in Singapore and in Chile right now.
That's very interesting. So this part of digitizing is built to the end consumer, which is the NRI, or is it built to the hospital?
It actually works on both the sides. The hospital digitalizes the health records. The patient can view it, their health records, that what are the medications they have to take, what were the health problems, and if he wants, he can share with his family members.
Right. So, that brings me to the next question, which says, what are the challenges that you face in terms of the business side and the marketing side of this particular service?
The first challenge was the healthcare laws. They are very, very strong in many of the countries, especially when we are trying to target NRIs from US and Singapore, where the HIPAA and the Singapore medical laws are very, very strong. First thing which we have to do is make sure that we understand and study each and every of these laws, which we did. So it's a very complete and secure system. We spent a lot of money on data hosting, which generally is not a problem for many of these startups, because they can go with $200 or $300 of data hosting. We had to spend tons of money just to make sure that it's a HIPAA compliant infrastructure.
That's very interesting. So you've done your homework. You already know your target audience. You're already driving enough revenue, I guess. Do you have a number for the revenue as well?
We are currently not revealing the revenue, but we can say that between August and November next year, we will be break even.
All right, so you're breaking even too. So that brings us to a very interesting concept, of health service for, all our NRI, Indians. They're going to be really happy saying that my parents are safe back home. Right. So coming just to the last question, which I just missed out. Do the Indians or do the children get to talk to the doctors after they get an fine, okay, or a health report of their parents, to actually understand what the ailment is in case there is any?
Currently, we are not providing that. And also, I just want to correct you that NRI doesn't get the health record access unless and until the patient has provided him the health access. Those are the privacy compliance which we have to follow. We can't just reveal the health records to even the kids. It has to go through the patient. The patient has to share or provide us that, yes, I want to share those things. Over the period of time, we will connect, and we are trying to connect the physician and the payer together, or the NRI. In the future, they will be able to interact with each other.
That's good. So wish you success. That's a wonderful and amazing product out there, and a long way to go too. So wish you success.